So I'm Dr. Moak with Allure, and I want to talk to you about NightLase. NightLase is a laser. It's actually two lasers, two different wavelengths, and it treats both snoring and sleep apnea. So snoring is where somebody's making obviously noise at night, and sleep apnea refers to when somebody stops breathing periodically more than about 4 times per hour. So there's a score you can get where you take a sleep test, a sleep study. It can be done in a lab where you're sleeping in some clinic's bedroom, or you can do it at home, which most people choose to do. And it gives you a score of what your sleep is like. And there's a normal score, which is less than 5. There's a mild sleep apnea, moderate sleep apnea, and severe sleep apnea. The good reason to know that is that if you have snoring and apnea, there's actually significant implications for quality of life and even getting to other diseases. The NightLase is designed to treat initially snoring, but now we can use it to treat and reverse both snoring and apnea. So the NightLase procedure, there's really no pre-op or pre-procedure instructions other than you should be well hydrated. So the laser does need moisture in your mouth to work. We treat different parts of your mouth. We treat the back of the throat, the base of the tongue, and underneath the tongue, the floor of the mouth, and it tightens the tissues up and regenerates them so the tissues aren't so lax. So when you fall asleep, your airway doesn't collapse on itself. That's really the cause of snoring and sleep apnea. The procedure itself is not painless, but it's close to it. It feels a little hot. It takes about 20 minutes or so. And the reason it takes that long is we have to go over it multiple times to get the tissues to contract and to regenerate. And your mouth will feel dry for a few hours afterwards, but there's no restrictions afterwards. Typically, improvements will be seen right away. And the procedure was designed to be done more than once. So on average, people who have snoring will see a 50% reduction in their snoring after 2 treatments, about 2 weeks apart. The 2 weeks is not critical. It's just wait about 2 weeks. You can wait 3 or 4 weeks, it doesn't matter. So about 50% reduction after 2 snoring treatments with the NightLase. You do more than 50%. For somebody who has apnea, where they actually have a test to show they stop breathing at night, we recommend a minimum of 3 treatments. 3 treatments on average will reduce your apnea by 2/3. Okay, so if somebody has mild to moderate apnea and they do 3 treatments, typically they'll have no apnea or mild apnea. If they have severe apnea, they probably need to do more treatments because 2/3 is not good enough. Okay, so 3 would be a minimum. The cost is $800 per session. The sleep study is a home sleep test is about $300. To do a sleep test, in a sleep lab is much more expensive. It's not necessary to do that anymore. So doing a home sleep test is sufficient. So the NightLase is using 2 lasers that's on the same machine to restore the tissues to a more youthful state in the back of your throat and your airway, so you snore less and or have less apnea. If you do have sleep apnea, it's a considerable health risk, and we'll talk about that in a different video, but apnea is something that really should be, do away with. Now, the current treatments would be a CPAP machine, and if you're using that and you're happy with it, you can just stick with that. Some people don't like to wear those, so that's why they're considering doing the NightLase. So thank you very much.